a surgeon, it's obviously my goal to provide solutions for their problems. And sometimes the best solution is surgery, and sometimes it is not. When someone is a candidate for surgery, they have to be healthy, they have to have an indication for surgery, and there has to be some obvious benefit for them to have surgery. The same with the RFA. In patients who require surgery, there should be a reason why that specimen needs to be removed and analyzed by pathology. And that's really the patients that we're taking to surgery, are those that you clearly cannot tell that the specimen is truly benign, or if it's too difficult to treat with a minimally interventional technique. So when you have to go to surgery, the patient needs to be healthy. They need EKG, they need lab work. They have to come in, check in the hospital. That takes a couple hours just to check in, be there in pre-op. Then they get interviewed by the pre-op nurses. That takes about an hour, hour and a half. And then you wait for your surgery time, which sometimes may not go on time. The surgery should take anywhere between an hour to 2 hours, depending on the operation. And then the patient is observed either for 4 hours immediately after a lobectomy versus overnight for a total thyroidectomy. The whole evolution is considerably more extended than a radiofrequency ablation. When a patient presents in my office for radiofrequency ablation, they check in within 10 minutes. They're in a room where we're preparing them and telling them about the procedure. The procedure itself, the setup takes about 15 minutes. The actual procedure takes anywhere between 30 minutes to 45 minutes in most cases, after which they're observed for 45 minutes with a nice pack on their neck, and then they can drive themselves home. So there's no general anesthesia, it's all under local anesthesia, and it's completely much more simpler from the standpoint of the patient. The benign nodules are really, to me, a no-brainer in the sense that it's clear that these interventions are quite effective in resolving any symptoms associated with them. You want the best results, clearly, and so therefore that's our goal, is to get the best results so that we can prove that it's effective, so that we can get it so that it's covered by people's medical benefits.